Hello, everybody. Welcome to the Very Connected podcast. And you guys are in for a special treat today. We have very special guests. We have April and Jason, who are BariNation founders. And we have really just partnered with them for some period of time. I'd say maybe, has it been 2 to 3 years? Maybe.
Oh
Oh yeah.
yeah, at least three. Yeah.
hmm
I remember whenever I first met both of you, I don't know if you guys remember this. We were at a bariatric society retreat, and it was the first one I think that they offered. And somebody introduced, they said, you have to meet these people. And so I don't even remember who introduced me, but that's the first time I remember meeting you guys. And then we just kind of just started conversations. And since then, I mean, there's just been endless talks and endless collaborations. And I just appreciate both of you guys for what you're contributing to this community and to all the people out there. And I'm going to do a more formal introduction, but I just want to say that to begin with.
Well, thank you. We feel the exact same way about you, Brenda, and about ProCare. From the moment we met, we were kind of kindred spirits in how we wanted to support the community, the direction that we wanted it to move in, and just being present and there for patients in ways that are meaningful. So we are aligned in all of the things that we are doing together and as individual organizations.
Absolutely. And I just I want to say hello to all of those people out there that are joining us on both the live event and at some point the replay. So thank you. And if you want to say hi, let us know, where you're from, if you're pre-op, if you're post-op bariatric surgery, or if you're just on a weight loss journey itself and you're just here to listen. Um, if you're on, whether you're on Zoom webinar, you're on YouTube, you're on Facebook, let us know. And I'm getting ready here to look on Facebook and make sure, see if we have any comments. So please do introductions. Like, let us know, as Jason and April are going to be talking about themselves here a little bit and going into our topic. I'm really excited about this topic because I feel like it's something that we've never talked about on this forum before, and yet it's so incredibly important in our weight loss surgery journey and actually just in life. And we're going to be talking about listening to our intuition after bariatric surgery. And we're going to talk about, those social pressures can affect our decisions. And many of us face decades of maybe not trusting ourselves in so many ways. And maybe it's our hunger signals, those intuitive hits we get, whether to maybe eat something, not eat something, and really just trusting ourselves in the decisions that we make in everyday things that we do every single day. And I even have to remind myself because it can be as simple as, it's not just about the bariatric journey. It can be as simple as just trusting yourself in every single thing you do. Like, I was thinking about this the other day, and it's like, even just simple things like locking your door. Sometimes I'll go back, I'm like, did I do that? And then I go back and I recheck it and I'm like, just freaking trust yourself. Like, you did it. Just trust yourself. Like the little things that we do over and over and over each day.
Mm-hmm.
So, at this, I want to just kind of do a little bit of you guys' bio just to kind of give them an introduction. I think a lot of people, if you guys know April and Jason, also let us know, let us know how you know them. And maybe if you've seen them before in other events, if you're part of the BariNation crew, which is BariNation is a community that supports patients at every stage of their bariatric journey by connecting members to each other. It's a membership community. And
Mm-hmm.
we'll be talking more about that. So kind of like stay on the call if you can. If not, you can always Google BariNation. April, also known as Actively April on Instagram, she had a sleeve gastrectomy back in 2019. And then Jason, known as the THA_Smithsonian at vertical sleeve gastrectomy in March of 2020, and then a revision to a single anastomosis duodenal switch in December of 2023.
Mm-hmm.
They'll both be talking about their journeys. And I'm going to turn the microphone over to you guys and let you do a more formal introduction of both of yourselves.
Okay, awesome. Well, thank you, Brenda, for inviting us onto the podcast. We love joining you on this forum, and it feels very familiar to Jason and I because yes, he and I and our friend Natalie make up BariNation. So we have a weekly podcast that we produce ourselves where we interview experts and fellow patients just like us to better understand what this journey is all about. We have a membership community that is really a community of practice. So we partner with experts in bariatric medicine to deliver weekly support groups, classes, and meetups. And our members get unlimited access to all of those supports, and they happen really each and every day throughout the day. And the wonderful thing about our community is that we support people in every stage of the journey. So whether you are pre-op, 1 week, 1 month, 1 year, 5 years, 10 years, 20 years post-op, we have support that is tailored to where you are in your journey. And then we advocate for patient needs on social media. And we do so with humor, humility, and honesty. When we first started out, we were known as East to West WLS. And that's because I live in Washington State, Jason lives in Florida. So East to West. And there really wasn't a lot of patient voiced supports out there. And we felt that that was missing. There are wonderful podcasts and resources out there that are offered by professionals, but it just is different when you are learning about it and talking about it from your lived patient experience. And kind of when it comes to intuition and some other things that we have experienced along the way, it just is different. So somebody who isn't living with the disease of obesity, somebody isn't treating it, doesn't quite know what it feels like, what that experience is like, or they might think that one thing is going to help, but in reality, we know it's just not. It's different. So that was really why we started BariNation. And like what Brenda said, I had vertical sleeve gastrectomy in July of 2019. I've lost and maintained around 150 pounds, and the things that have helped me do that is, of course, my surgery, but the community. Each and every day, I am a member of BariNation, and I rely on those supports, and I practice what we're learning there. So that's a little bit about me, Mr. Smith.
Yes. So like Brenda said, I had the vertical sleeve gastrectomy in March 11th of 2020, and then I also had a revision to SADie in December of 2023. So I'm knocking on the door for my 1 year of my revision post-op. I've lost and maintained about 189 pounds, I think it is now. Just the fire that is in me to support the entire bariatric community as much as possible really started after my initial procedure, just simply because I didn't know what I didn't know, and I knew that if there was lots of things I didn't know, there had to be other people that were in the same boat as I am. I knew that if April lived on the opposite side of the country and we were having the same experience, that there were people all in between, up and down, that had the same issues. So it really was important to me in finding the information I didn't know. And then when April and I got together, we just kind of ignited the passion in each other to bring as much help to the community that we could possibly bring. I know, one of the most common quotes that I use that really resonates with me is there are two important dates in your life: the day that you're born and the day that you find out why. And having this procedure has given me my reason why. And it really ignited, like I said, that fire in me to kind of go forward and help everybody that I possibly can help recover from the disease of obesity as much as we can.
Mm-hmm.
I love that, what you were just saying about the day you were born. Like, what do you think, like, your passion? I'm curious about this. So you share within BariNation, but you also share with the community. What would you say that passion is?
I
Ooh,
know for
me.
me, it really just is like, I know when I was trying to look before I even had the procedure in the first place, it took me probably almost 2 months to find somebody that looked like I look. Because, being a man, being sick, I'm 6'4" and weighed 468 pounds. And for me, I know that it was very hard for me to find somebody that I connected with that looked like I did, to know that it was going to work for me, because this is predominantly, females in the group, which is awesome for me. Like, I love the fact that there are so many women out there that are getting the help that they need. It's fantastic to me. But that doesn't mean that it's going to work for me, because I don't know anybody that was my build and makeup. And so when I found somebody finally that I could see had success with it, I was passionate to start, singing from the rooftops about what I was having done, so that the next person didn't have to wait the same amount of time that I did, or they didn't have to wonder if there was somebody out there that, looked like them or that they could resonate with. And so that, to me, I really kind of set out on a course to make sure that nobody else felt the same way that I did. And that's how I found April, and we got connected.
Hmm. And I think passion and intuition are actually a beautiful married couple, if you will, because your passion is really driven by your intuition. If you are not really listening to who you are at your core and what your purpose is here on this planet, you're going to feel like you're going in the wrong direction. Right? If you guys have ever seen, a flood, or you've been spent time around water, right? When the tide changes, when things are not aligned and kind of going in the direction that they are built to go, you get big waves, you get things that are swirly and whirly, and it's muddy and it's murky, and you just feel like you're stuck, or something is not right. That's your intuition. But when we spend time and really think about what our purpose is here on this planet, what we are passionate about, what we are excited about, what lights us up, what keeps us up late at night, or what inspires us to get up early in the morning. If we tap into that, then things start moving in a direction that feels easy, right? Or you could be noticing, like, oh my gosh, like this opportunity just like fell in my lap, or like, oh, I'm so fortunate that these things are happening. We all know what it kind of feels like to be on a roll. And when we listen to our intuition, when we listen to that voice, or when we pay attention to that spark that lives deep inside of us, things start happening in a really good way. And I think if we're on this journey, this bariatric journey, this obesity journey, weight loss journey, whatever you want to call it, when you made that decision to have surgery, you probably noticed that shift, just this teeny tiny, like, oh, something is different. And it feels a little bit like, not scary isn't the right word, but right, but you feel this like butterflies. It's like this anticipation, but it's the feeling of something that, like, yes, this is the direction I want to go. And the crazy good thing about intuition and about passion is that you don't have to be 100% sure that that's the direction you want to go in, but it's this pull to move in that direction, and listening to that, that's intuition. That's passion. That's what moves your life in the direction that you want to go. You don't have to know the final destination. You don't even have to know exactly where. You just need to know, this is the general direction that I want to start moving my life in. That's intuition, and that's passion. And when you live those two things, your life just makes more sense.
What is that for you, April? The passion part. What got you, like, what gets you going and motivated and all of that?
Y- Yeah, one of the most powerful things that I've learned along my bariatric journey happened when somebody asked me kind of exactly that. I am a very fortunate person. I've known, my earliest memory truly in life is me knowing what I wanted to do, and that is to teach. I've been placed on this earth to be an educator, to be a teacher. It's what I'm passionate about. It's what I'm drawn to do. It's what I've always loved to do. Um, and teaching means a lot of different things, and it looks different in a lot of different capacities. But it's what I'm good at. It's what I love doing. And I've known that this is what I want to do, have to do for a very, like I said, for my entire life. And I know for a lot of people, it's not the case. My sister, I'm so close with, we're almost twins in so many different ways. She struggled with that question her entire life. So I understand that. And I want to acknowledge that it's also normal to not know what your passion is. But when my bariatric therapist asked me during one of my sessions, what is your purpose? It took me a while, a couple weeks to really kind of sit with it. And I went through a couple alliterations. And I guess what I mean by that is I tried on a couple different purposes. And I just kept telling myself, this is my purpose, or I'm here to. And the one that stuck and has continued to stick for many, many years now is my purpose is to be a force for good. I'm here to be a force for good in the world, in life, in my life, and in other people's lives. And the reason why that purpose feels so right for me is because it doesn't exclude me from my own life story. If I'm not being a force for good for myself, I'm going to have a really difficult time being a force for good for others. So where I guess my purpose and my passion combine is if I'm here to be a force for good, and my passion is to teach, um, when I discover things for myself, when I make breakthrough moments or aha moments, or I learn something, somebody shares something with me and I'm like, oh my God, that makes this math equation make sense, right? This helps me along my journey. I tell it to Jason. I tell it to Natalie. We have a conversation about it. Then we talk about it on the podcast. Then we're introduced to experts that help us understand that more. Then we bring that learning into our learning community, which is BariNation, right? That is our community of practice. So as I learn things, as we learn things, as we talk about them, as we share how we're applying in our bariatric journey, we get to pass that knowledge and that information on. And we do so in multiple ways. We do so on the podcast, which is a one-way sharing of information. Here you go. Here's what we've learned. But if you're really ready to take that learning into your own life and practice it, understand it, kind of like digest it. BariNation is a place to do that because it's a community of practice. So you get to learn these new things, try them on in your own life, and then basically report back to peers and experts. So it's where you actually get to practice the learning that you're doing. You can't really do that on social media, and you certainly can't do that in a podcast. We can pass along information, but we don't know how you're using it. We can't see you taking it in and really apply that learning. We get to do that in BariNation, which is what makes it so powerful, because it is a private community. So you don't have to be worried about somebody judging you or questioning why you're doing something or trolling you, or none of that exists in that safe, private space. So really, no matter where you are in your journey, we're really trying to be this force for good in people's lives. And we're trying to not only pass along knowledge and learning, but give people that safe place to practice it.
So I would say part of your purpose sounds to be not only the education piece, like helping other people with their growth, but also being able to be a support with that growth, like to see it happening and to be a person to part of that. And I think for me, I actually it's funny, I have a couple sticky notes here because I have them on my computer to remind me because like year to year I try to like yes, is that what yours is? Yes, I try to remind
Mhm.
myself, okay, why am I getting up this morning? What am I doing? One of them says, I am making major contributions and changes to this world for humanity to increase conscious awareness. Because once we're conscious of stuff, we can make the changes. And then also,
Mhm.
I'm an expression of God, which everybody's definition of God is different, but we all are that. We are all an expression. And when you think about yourself in that way, you're perfect no matter what.
Yeah.
You know what?
Mhm.
There's not this I'm unworthy, I'm not, whatever. You're just perfect no matter what. So if you're an expression of something this much bigger than what you consider yourself to be in this little human body, this little human
Mhm.
suit, um I would challenge everybody on this call. If you're listening now or if you're on a replay, let us, if you feel comfortable, like, have you dove into what is your purpose? What is your passion? And like, give us a little tidbit of that. We'd love to know because, and if you haven't dove into that, it's not necessarily something maybe you can answer. Like April said right away. Sometimes it's like a little investigating. It's like, maybe it's just, I'm simply a symbol of love. I'm just simply it doesn't have to be this major long-term thing. It doesn't have to be contributed to. I wouldn't say it would have to be like exactly what you're doing in this world. Like you're doing it. Like April, you could be educating on STDs. You could be
Yeah.
educating on blah blah blah. But I mean, you've went through, I think we're always able to do something aligned with our life experiences. And I would say if your life experiences have taken you somewhere, you have experience in that, and you can definitely have a way to talk about it. So you're educating, both of you are educating in ways of things that you've learned and things that you're able to do.
Mhm.
Well, and like you talked about, like it's like we say with your why of why you had surgery in the first place. Those can be fluid. Those can change. I mean, you'll have
Yes.
a core couple of whys that may stick with you, but you'll develop additional whys as time goes along. And it's the same thing with with your passion and with your journey with all of those things. That's all fluid. You can adjust it, and what drives you today may not drive you tomorrow. Doesn't mean you
Mhm.
can't go back and pick up what drove you yesterday. It just may look a little different, at the time, whenever you decide to switch it up. But at the same time, it's not about what drives you. It's that you're driven, period. It doesn't matter where it takes you. There's alternate routes to get to the same place for a reason. Like just because you and I are going to the same place doesn't mean we're going to use the same roads to get there. And there's nothing wrong with that. A lot of people feel like they'll get a little bit of a shame or guilt going on because it's not the same, they're not the same why or not the same passion that they had. But there really should be no stigma around it. It's really not about that. It's about just the fact that you are driven and that you are headed to somewhere, not just sitting in it and go, well, I had the surgery, and so that's just gonna be better now. Like the
Yep.
difference is it's going to be like you're going to have to find something that continues to drive you towards a healthier version of yourself.
Yep. And I was just going to say what Charlotte wrote in the chat, which is exactly what you're talking about, Jason, right? Our whys are absolutely going to change as we move
Mhm.
through our bariatric journey, right? It's going to start off as one thing and it will morph into others. We talk about this often in the BariNation membership community. Our whys, usually when we begin, are kind of more of a goal, not necessarily a why, right? Our why should be something that is, greater and beyond us and doesn't necessarily have an end date. But when we first start off, you don't know that, and that's okay. So as we check off our whys, it's really important to revisit them, right? Why do I continue to do this work? Because it's hard. The same thing is true for our purpose and for our passion. Your purpose in life is going to change based on your life circumstances changing. If you become a parent or a grandparent, your purpose in your passion is going to change with these new people that come into your life. You are exposed to a new career, you make a decision, or maybe you're battling cancer, we're all battling the disease of obesity. Our purpose is going to change as our life changes, and being able to flex to meet ourselves where we are in the moment is one of the most powerful tools that we can use, and our intuition is what can guide that if we listen to it, if we pay attention to it.
What do you consider your intuition to be? How would you explain that?
Oh, well, my intuition is that little voice that is always talking to me. And the trick with intuition, I think, for people who are battling the disease of obesity also has a voice, and it's constantly talking to us. Some days it's loud, annoying, obnoxious, mean, derogatory. Other days it's very quiet, it's a whisper, but that voice of obesity is there. And the trick to this, the key to this is learning how to differentiate your intuition, your voice, and the voice of obesity. And it presents itself in many different ways, right? It's hunger signals, it's food noise, it's that constant voice, that chatter, that you know somebody in our community calls it, right, you always have these like two things, two people, two entities sitting on your shoulder. Well, one of them is your intuition, but one of them is obesity, and they're constantly doing this. And you really do have to practice listening and differentiating between the two. Oop, Brenda, you're muted.
Whoops. Um, I want people to comment. It looks like I want Jason to you to answer that too here in a moment, but I see that there's people commenting. Let us know what you think intuition is. Jason, let us know what you think.
For me, I think my intuition has developed based on an amount of trust that I've been able to build with myself. because a lot of times when I was at my heaviest, like April was talking about with the obesity has its own voice as well, I listened to that way more than I listened to myself. So
Mhm.
it took me building a level of trust with the new opportunity at life that I was given post-op to develop an intuition that serves me better than my previous intuition did. So it took a lot of very tough conversations that I had to be brutally honest with myself and realize that I really did do a lot of things that did not assist me in living a healthier and better life beforehand. And that if I wanted different, I had to choose different and be different. And so now my intuition, like a lot of people in the chat are saying, they're following their gut to do the right things. But like I said, my gut before led me down a way wrong path. And I was nobody to try to stop it either. I was like, yep, that's what we're doing. Let's go. Woo. Like, I just dove right on and grabbed on and hung on for dear life. Um, so for me, I know that once I had those, kind of gut checking conversations with myself, I was able to kind of lean more into the intuition side of things now, that I'm post op, which is kind of what led me to have my revision in the first place. My intuition let me know that that I was not going to. I didn't want to sit where I was, and I wasn't going to get. I had done everything I could do to get better at that point, and it just the obesity would the disease of obesity was winning at that point with my 58 pounds of regain that I had. And so in speaking with medical, my intuition led me to go speak to the medical professionals who let me know that I needed to have my revision. And since then, my intuition also led me to get back in the gym and start working out and moving my body more, which has led to just more success in my post-op life. So it's one of those things that came about due to having very tough conversations.
And Jason, I want to make sure that you are giving yourself enough credit here. When you made the decision to have your revision, there was a part of you that knew something was wrong and you just didn't know where to go or like what to do or like how to have this conversation, but you knew something was wrong. And Natalie and I kept having conversations with you. We would ask you questions, right? We would push you to do these things, and you would tell us one thing. We knew that it wasn't true necessarily, but you just know, right? When your friends are kind of like lying to themselves or not being truthful with themselves, you know it, but it's hard to have them see that as well. But what I guess the point that I want to make is that you knew deep down inside that something was off, something was wrong, and that there was more for you on the other side of what you were going through, and you didn't give up. So I guess what I just want to let people know is that even if we don't listen to our intuition right away, it's still going to be there. It's that little tiny voice that's just nagging. There's just something there that you're like, gosh, but something is off or something is wrong or what am I missing? Right? It's that. And you had that when you were kind of at that really dark place for you before you made the decision to have revisional surgery. Your intuition was there. It was just so hidden, so kind of pushed down by the disease, that it can make it difficult. And if you don't have people around you that are rooting for you in your corner, it can be hard to listen to.
Oh, definitely. Yeah, no, it was. I sat in that for about 9.5 months, really
Hmm.
just kind of beating myself up about it and not wanting to listen to what I knew was true. And the voices of obesity get really loud, and they can drown out anything else that you're trying to listen to try to try to take over. And I had almost gotten to a point where I just let it and just said, this is what my life's going to be like forever. Like this extra weight's just what it's going to be. The comorbidities are coming back, like some of them never left. And it was just what I thought was going to be my new reality. But luckily, like I said, you said for you and Natalie staying on me, and my wife Sarah still also staying on my case about it in the most loving way possible. But honestly, just letting me know, like, there's something that needs to be addressed. Like, like, I'm not happy. Things aren't going well. I don't feel well. And, the reversal is so stark. Like, it's not like it was it's taken a lot of time to get. like I went from feeling perfectly fine to not feeling fine pretty damn quick. So
Mhm.
it was hard for me to get, out of that, to even drag myself out of it, to even start talking about what needed to happen. So I'm very grateful that I had people in my corner that cared enough to stay on me about it.
And there's quite a few comments here. I'm going to kind of read some of these. There is someone who's asking about what a revision is. So do you want to, I think it may be different for different people depending on what their primary, so it's a primary procedure. You had primary procedure, weight loss surgery procedure. In this case, we're talking about, and then for whatever reason, sometimes there's complications, sometimes there's not enough weight loss, you want more weight loss, sometimes there's maybe other reasons, but it's a procedure that is done after the primary weight loss procedure. And yours, Jason, was a duodenal switch, correct? Single anastomosis duodenal
Uh-huh.
switch.
That's right.
Okay.
Yeah, from the sleeve. So when I initially had my VSG, my surgeon had let me know that at the age of 44, and my highest weight being 468 pounds, I was too high risk to have anything else. So they started me with the switch, or with the sleeve, and said, once you lose enough weight, we'll go back in when you're lower risk, and we'll revise you to a bypass. But in my mind, I was just never a fan of the bypass. It wasn't something I wanted. I didn't think it was going to work well for my makeup, my body. So in speaking with another surgeon, he let me know that the Sadie would be a better fit for me and my body. So that's what I had done revisionally, and mine was due, and just from the start, I was told I was going to have a revision. So
And I think it's important to say revisional surgery isn't it's not a bad word. Like revision is not a bad word.
right.
Plenty of people in this community need that secondary bariatric procedure. Obesity is a lifelong and chronic disease. And the surgery doesn't cure that disease. Surgery helps us treat it. And as our life progresses, sometimes the treatments that we're using stop working. They lose their efficacy, right? Those comorbidities come back. And revisional surgery is necessary and needed. And there are quite a few people who undergo that first procedure because it has lower chances of complication or risk. So you go into a surgery having a sleeve, knowing that you are going to need that revisional surgery to a different style or kind, but because your starting weight puts you in a category that made it not an option to have that revisional surgery first. So tons of reasons why people undergo revisional surgery, not a bad thing at all. Revisional surgery helps people continue to treat their disease of obesity, just like as it has with Jason. And I put in the chat, you guys, we had a great episode with two phenomenal doctors, Dr. Joe and Dr. Chen, about revisional surgery. So if you are curious about that and you want to learn more, absolutely check out that episode. And I think, Jason, there was another question in the chat for you. I got to go up.
Yeah,
Um,
Charlotte asked me a question, but I couldn't get to it.
oh, yeah. Do you want to answer it now?
Yeah, what was it again?
Oh, I got to look for
Like
it.
I can, I was like, I can't see what it is.
There we go.
I'm gonna
So she
unmute
said, Jason,
myself. Yes. You
do,
found
yeah,
it,
do you,
April?
yep, I did. Yeah, Jason, do you think that was more due to the excess weight and the need to feel some acceptance or validation? So I think that was related to, yeah, your decision to have revision.
Yeah, I know for me, I was seeing changes, feeling changes, and had um labs done to show changes, and none of those things set well with me. Um, and I, getting below 300 pounds for the first time in my adult life, almost, um, was amazing for me. But then when I saw things start to go the opposite way, and then I wound up, because it was one of those things where I told myself I'd never be above 300 pounds again. And then when I got back there and then started creeping back, and then ended up at 353 pounds, where I sat for like that 9 months I'm talking about, like I didn't feel good. I didn't, to me, I could tell my body was changing and not in the best way. And I tell this story that really kind of brings it into focus. Like when I went to the second JBY Awards, I I was presenting, and when I walked in and saw that there was no podium, I almost left. And if you know me and have been with me at any bariatric event, you know, I stick there. I'm in for the long haul. Like I hang out, I do all the things. I hadn't been there 10 minutes and I wanted to leave because when I looked up on stage and saw there wasn't a podium, there was nothing for me to hide behind. I was just me. I had to stand there in front of everybody, the entire community, and let them see what had happened, like that I had regained weight, that I was having issues. And this was before I accepted what had happened and knew that there were, had decided there was another road for me. I was just sitting in it and in that shame and in the despair of what had happened, thinking that everybody was going to look at me and think I was a fraud, because how can I talk to people about this every day on, amazing forums like this, but also be battling regain at the same time. And, there was a lot of tough conversations had that very night with me that let me know that that what I was saying to myself was not the right way to go about it. And the things that I had been telling myself for 9 months weren't right. That regain is, it is a symptom of obesity, and it is a chronic disease, and it will always come back. And adjunct treatment is a thing that not only is available, but it's needed. Like adjunct treatment in one way or another, everybody is going to have to onboard it post-op. So at one point or another. Yeah, imposter syndrome was absolutely real for almost a year's worth of me sitting up talking about it and doing a lot of fancy camera angles and things. Like my face wasn't part of my body. You couldn't see that it was getting bigger. And as long as we're in the Zoom screen, I'm fine. Like no, everybody knew it. I was only lying to myself. So
Mm-hmm. And obesity is so tricky because oftentimes it's not a single thing. It's a combination of things, right? Like Jason, your comorbidities were back, your health was declining, you were experiencing limited mobility again. Your size and shape was changing, your mental health was affected, right? Like it's not just like one thing. It is a bucket of things. And it can be so frustrating when, as a patient, you experience this. You are as that episode, as Dr. Joe and Dr. Chen explained in that episode with them, as patients, we really are doing everything right. And the scale will not respond in the way that we want it to. Our bodies will not respond. It's because it's the disease. It isn't anything that we're doing. But we so easily slip back into that old mentality of like, well, this is my fault. I'm doing everything wrong. I just need to eat less and move more, which we know is not an effective single treatment modality for the disease of obesity. But we quickly go back into that shame cycle, that shame spiral, right? We guilt ourselves, we blame ourselves, we do all of these things, and we just go right back to doing all of the things that we were doing before surgery. That doesn't work. If we truly want to treat this disease, we have to do things differently. We have to think differently, act differently, behave differently, connect with different people, right? Onboard different treatments. And it's that push to constantly do that work. And I think it's why we see a lot of people in this community kind of ghost, or they disappear, they give up, they regain all of their weight, and they think that it's a them problem. It's not. It's a disease problem, right? Your disease is progressing. And that's why these conversations, BariNation, these spaces are so important, because it is a lifelong and chronic disease that will require ongoing treatment. And that treatment is going to change as our lives and as the disease progresses. And I'm just so thankful that so many people, Jason included, are willing to talk about that, because there is no shame in treating a disease. No other disease on the planet would we ever shame somebody for treating. You're not going to make fun of somebody because they take insulin for diabetes. You're not going to, rag on somebody because they take high blood pressure medication. Like, you're not going to be like, oh, you shouldn't treat your cancer. Like, it's insanity. But yet we feel that it's okay to do that when it comes to the disease of obesity. But again, that's where our intuition is so powerful. There's something inside of you that is telling you something is wrong. There is something else out there for you. There is another opportunity. There's another option. There's more treatment. Don't give up. Keep going. If we listen to that, and if we just focus on that, we can move our life forward. But if we ignore our intuition, if we let that disease voice speak louder than our voice, We're gonna
And
find
it would be,
ourselves.
yeah, I think it would be nice if there was a one point answer, like Veronica asked, what helps with fighting regain? I'm now fighting after stomach infection. So like for what works for me, what worked for Jason, what worked for you, April. We've all been through that, like with bouts of regain. I mean, I've heard
Mhm.
you share your story before too, and for me, this last year, it's been working on that too as well. And so, what I would say to that question is, ask yourself that what is going to help you? Because I knew for me, like we know this is again going back to intuition. For me, it was not a one step approach. And it wasn't maybe the same things as what April and Jason are going to answer. We're like, maybe some of those things might be, it might be revision. It might be going to see your primary care. I know Christine mentions, start tracking. So you have data to give to your doctor. It may be the inflammation from your stomach infection. But like, listen to what your intuition is telling you. For me, I knew I needed to move. I needed to get back in the gym. I needed to move. I needed to have an outlet for some of the energy that I was like I was just being at my house all the time because I work remote, and I know I needed something more. Also, I needed to have something to help boost me, and I knew for me it was going to be a GLP-1. And so I started talking to practitioner. Also, I knew I was going through menopause. So I knew that that would be a helper. Menopause leads to whether you're a male or a female, whenever you get to certain ages, sometimes your hormones change. And I knew that looking into that also, if your nutrition is not quite in check, maybe you're not getting enough protein, maybe you're not getting enough fluids. Only you know these things. Like you know what you're doing and what you're not doing. Like what is going to help you? Is it going to help to go talk to a practitioner? Is there a revisional status? Is maybe your surgery not working how it should? Should you have additional testing to make sure maybe your anatomy is working properly? So to
Mhm.
answer that question, I feel like it's kind of hard because it can be your medications. A lot of people have medications that they're on that affect their weight loss or gain. So not to interrupt what you guys were saying, but I think it's in genetics, and Ina said genetics. All of us are built so differently. So I would say listen to your intuition and go at it if you need to go at it at 100 different angles, like start listening to what your body's telling you. And I'm going to kind of just say something about intuition here too. I think for me, these guys know because I was talking to them about some classes that I'm doing in January it's going to be around the subject of intuition, meditation, like all these therapies that we can use to kind of get our body back. Um, Kind of personal development, but more in the line of techniques that you can use to kind of balance your body. And for me, whenever I first started doing some of those techniques, let's say intuition, there was a lot of techniques that would go in, like doing a meditation, go in and you could um, get advice from a higher level. Okay. I'm just going to say that advice from a higher level. Maybe it's your what you call your higher self or whatever. Or it could be from a guide of some sort. So at this point, what I just want to say is when you starting to try to listen to that, you call it an inner voice, you call it this knowing. It sounds like you're just talking to yourself, or you think you're just talking to yourself. It's not that, guys. If you that knowledge is coming from somewhere. It's
Mhm.
coming from somewhere. It's being directed from some place. So like being able for me, the first beginning steps is actually trusting that. And for me, what it took is actually taking a notebook, writing down all the gibberish that seemed like like nonsense. I'm just going to call it nonsense. It could be like a symbol of a sun that I was getting as far as like these hits of information that was coming to me. And then like take that, decipher it, and like really look back over it whenever you're not in that mode of like discernment, because
Mhm.
we get this information coming to us it's from all the time. Is it coming from other people? Like we have to discern if it's coming from other people or if it's coming from someplace within us that we just know. And the only way, I think it's a feelings thing. You have to listen to your feelings of if it feels connected, it's more of a higher feeling of maybe empowerment or joy or love or whatever. If it feels like a lower feeling of despair or anxiety or frustration or anger, like where's that coming from? So that's just
Mhm.
my 2 cents.
Well, and Brenda, we appreciate you saying that, because one of the things that we uh, say all the time in Barry Nation, in those classes and the meetups, that a big tool that we give people is just the power of slowing down. We ask ourselves 10,000 questions every single day, right? We are constantly saying, why am I doing this? Why am I struggling with this? Why? All these questions. We never, or very rarely, take the time to actually answer the questions we are asking ourselves. We just don't do it. But that's how you tap into your intuition. You have to slow down. You have to get quiet. You have to block out all of the noise, all of the things that are coming to us all day long. And we just have to sit with ourselves, be quiet, and answer those questions. That is our intuition. The answer really does lie within ourselves already, but it takes effort to slow down, to get quiet, to take the time to answer those questions. But as soon as you start doing that, you start getting the answers that you really have been seeking. You start tapping into what is actually true for you. It's way easier to not do that work, to just say like, oh, I'm just too busy, or life is just so overwhelming, or but that's giving away your power. You're literally giving away your ability to change your life, or to point your life in the direction that you want to go. Why? Because it's hard. Because the path that we have chosen for ourselves is difficult. Treating this disease is work. So it makes a lot of sense that with everything else that we have going on in our lives, we feel that we don't have the energy or the time to pour into ourselves. But if we keep choosing that, we're going to keep our life is not going to go in the direction that we want it to go in. But as soon as you start carving out a little bit of time for yourself, you're going to notice this shift, and it becomes easier and easier and easier to choose you, to listen to your intuition than not. That's again the power of being a part of a community of practice. You are committing, you are saying, this is important, I'm going to dedicate just a little bit of time to this. It can make a difference in your regain battle. It can make a difference in any facet of your life, uh, because the first place to start is with you.
And I think that when we go back to talking about, like other things like that can help too is spending a little time each day. For me, that's been for the last year on my way to get back to my goal weight, was spending time doing that, spending time on personal development each day of some sort of growth, because you guys, we're here to expand. You're not going to want to stay the same. I want to say to the April, I think it was last year at this time that all of us had a call. Jason, I don't remember if you were on the call, you might have been, but I remember us talking about the slowing down. And I think I shared with you my little story about like going into town, and I live out in the country. And on my way into town, I was greeted by, I think it was 7 or 8 turtles, meaning every little way I would drive, I would see another turtle crossing the road. And I was like, okay, this is a symbol. Slow the heck down. I
Mhm.
mean, it was like slow down. It was like a symbol for me. And now I have to laugh because every once in a while I still see them turtles out there. They just make their way, and you have to like out in the country, you just have to slow down and make way for that turtle to go across. But it's just like, you know what, guys, if you were to slow your mind down, what happens is your whole world slows down, because
Mhm.
your inner world, your outer world is only a reflection of your inner world. So like if you find your day, like all I can relate it to is whenever I worked in the hospital setting, I worked in ER, and you can imagine there was days it was super stressful. You have a lot going on, and I had the great ability to take on everybody's feelings and emotions. So I would get myself in a hot mess, and I go in the bathroom and I would breathe, just sit there and like take some deep breaths and just relax my body. And when I came out, I was like a whole different person. It's just
Mhm.
like clicking that reset button for yourself. And what happens is when your inner world slows down, your whole outer world slows down. So whatever
Yep.
seems overwhelming that you can't do, that you don't have an answer to, because maybe you don't have an answer to how to go about regain. It may seem overwhelming, but slow down and then just start listening.
Well, because, so often in our journey, we just assume that you've got that 12, 18-month honeymoon period and then it's over. Like everything just stops. You get the after picture and that's what your after is, and that's all said and done. You get a before picture and after picture and you're off the ride. But honestly, the slowing down portion of it comes with you have the rest of your life to figure this out. Like we're not off the ride until the ride is over, like until we no longer exist. So honestly, when everybody wants to rush to figure it out or rush to get their goal weight, rush to do these things, it really is taking the time to slow down and figure it all out step by step. Because if anybody knows, like me, like I equate it to cooking in the kitchen. If you don't slow down and think about exactly what you're doing methodically, you're going to miss a step. You're going to leave an ingredient out. You're going to leave a measurement out. You're going to do something, or you may grab the salt instead of sugar. There's lots of things you can do if you're not paying attention. And that goes by trying to speed through it and rush and rush and rush. But slowing down gives you the opportunity to not only figure out what your next step is going to be methodically, but also it gives you time to enjoy where you are. Meeting yourself where you're at in the journey is one of the most undersold flexes we can have. It's awesome because I've never been where I am right now. So it's awesome to me to kind of sit in that time and relish the fact that I did that. Check out a before picture and be like, you know what? This is really cool. Like I've honored my before self by how I'm living now. And you take those steps along the way and bring that all together, and that's your journey. But at the same time, if you're speeding through it, you're going to miss most of it. And that's like, everybody, like I said, wants to get to that after picture, but your after picture is never going to be the same. Like my body's changed dramatically since a lot of my after pictures have started. And
Mhm.
that's a beautiful thing. Like the most beautiful part about it, like you said, Brenda, is we're always evolving. If you're not evolving, not moving, not changing, not looking for the next thing, then what's the point of getting the second lease on life if you're not doing the most with it that you could possibly do?
Mhm. And that was a big shift for you too, Jason, right? Like learning to slow down. We I sound like a broken record, but we say it all the time in BariNation. Sometimes we have to slow down to go fast again. And it's true. We think that right speed is our friend. It's not. In certain situations, no, absolutely not.
There's a question here. Somebody's asking, how do you determine which type of weight loss surgery is best for you? How much input does the weight loss surgery team have in what surgery the patient has? And so,
Yeah, I mean, the person who determines that is you and your bariatric surgeon. Your anatomy, your comorbidities, your health history, your goals, right? What your body is capable of is 1,000% what determines the surgery that is right for you. There are options out there now, but working with your care team, having conversations with your bariatric surgeon about the procedures that could be right for you, the benefits and the drawbacks to them, and that final decision is between you and your care team. Going into that consultation, going into those appointments, understanding the options that are out there for you, absolutely important. But that is a decision that is made really between you and your care team.
Yeah, and don't be afraid to shop opinions because
Mhm.
you have that ability. Don't think that just the first place you go to or the first doctor you talk to, like that's the law. It's not. It's like shopping for a car. It's like shopping for anything else. If you don't like the first one, go to the next one and see what it is. And you can go back to the first one. There's nothing saying you can't go with the first one if you like but don't feel like you're just hooked with one if you just go to one and talk to that person. You can do the whole intake. You can do it as long as you don't have a surgery date. You can go talk to anybody you want to. Like my original surgeon here in Florida is not the surgeon that did my revision. I had my original surgery here, but I flew to Dallas and had my revision with Dr. Cribbins. So
Mhm.
you have options out there. So just, I would exhaust all options and efforts if you have done your own research and find that you may want something different than, because my original surgery center only did sleeve and bypass. That was it. And I knew that I wanted a different option. So I went and found where the other options were. And if that's
Mhm.
something you've done research on and think that one of the other procedures may do a little better for you and you want more information on it, continue to search until you find a center that does what you're looking for.
Yep.
And I think and I think the question is how do you know what is the right decision? I think it's listening to your intuition. Like, how do you feel when you talk to that doctor? Do you feel like, or whether it's your bariatric surgeon, or maybe it's, a counselor, or like a therapist you're working with, or maybe it's a dietitian or a fitness person. How do you know if that person is the right person for you? You just, because of I think it's your feelings, like listening
Yeah.
to how you feel, whether that person kind of like it brings you up, it elevates you, it makes you feel like whole, it makes you feel like they're listening to you. You know that your questions are being answered. You know that you're being appreciated. You know that you have a feeling that this is going to help, rather than the opposite. And Christine, who is one on your team, the BariNation team, she's been making all kinds of wonderful comments and helping. She says Dr. Eric Smith said on BariNation podcast episode, isn't a stall the point? It's a practice for maintenance. We've shared our whole lives, losing and regaining weight. So embrace the plateau.
Hmm.
Yeah.
It was a very powerful episode, and it's hard for us, right? Because you go into surgery ultimately knowing that the goal is maintenance, that the goal is to get to a low weight and stay there. But then when you are faced with that reality, it's scary, because you do kind of get hooked to the loss. You get hooked to the dopamine. You get hooked to like, oh, I'm lower on the scale, or now I'm in a different set of sizes, or your friends and your family are commenting on how you're changing and you're feeling great. Well, when that stops, so does those dopamine hits. And that can be disappointing. When our weight plateaus at a number that we are not comfortable with, that can be disappointing. Right? But that ties back to our realistic or unrealistic expectations for this journey. It ties back to the fact that we can be scared to get to a low weight because we probably have never maintained before. So then that little voice in the head starts coming back and is like, you're not going to be able to do this. You've never done this in the past. Like, what makes you think that you're going to figure it out now? All of that thinking comes to the forefront of our brain. So yeah, stalls and plateaus are scary because we have to face this reality, and we have to also acknowledge all of these things that we've been thinking up here. Again, it's the power of having a place to practice these conversations, right? To ask these questions and to hear the advice and the recommendations from not only experts in the community, but people who are living it with you. It's one thing to, right, to say that or to ask that question. It's another thing to have that question be met with love and kindness and being seen and understood and empathy. We're not going to figure it out the first time. It is going to take a lot of time to really embrace and practice and understand what that means for us. It's why being an active member of a community is such an important tool along this journey.
Yeah. Well, that's why space and grace is so important, because you have to give yourself space from what you're struggling from, but you also have to give yourself the grace to figure it out and get to the other side of it. So, I mean, it really is one of those times where you have to embrace that mindset.
Hmm.
And I'm going to take one more question before we kind of do recap and share where they can connect with you all. So somebody's asking, and this is kind of it's a little bit on more of a medical condition. It's how about life after a total hysterectomy? I had surgery 7 days ago. Do you have any pointers? I don't want to make this all about me, but where this is where I am now. And I think that that's actually absolutely a great question, because whether you're a male or you're female, our body definitely goes through changes after weight loss surgery related to hormones, whether you've had this type of surgery or you've had just life in general happens. And I would say, I mean, I'm going to let these guys answer too, but I would say from a standpoint of hormones, those are things that can be checked, because hysterectomy is a surgery. And depending on when your first surgery was and how that's affected, I would definitely talk to since you're female, I'd say talk to your OBGYN, your primary care. You could talk to your bariatric surgeon, but I feel like that's more of of the lines of a doctor who can monitor those kind of levels, like the hormone levels and things like that. Anything that you guys want to add to that?
I mean, I would say, I guess how I read your question is you're feeling a little bit guilty about taking the time to heal and learning how to do life after, right, this total hysterectomy. And I mean, I guess my feedback for you is you absolutely should take this time. This is about you. You just went through another major life-changing operation and procedure. You are missing parts of you that you were born with. This is a time for grief. This is a time to process. This is a time to heal. This is a time to absolutely put yourself first so that you can come out of this the best, most healed version of you. So it's not about being selfish. It isn't about any of that. It is about acknowledging that you've just gone through a major medical procedure and you need the time and the space to heal, not only physically but emotionally. So yeah, I would do everything you possibly can do to put yourself first and to make sure that you can heal.
Yeah, the hard part about major surgery like that, regardless of what part of the body it's on, your body holds on to everything that it can to heal. So that's where the swelling, the inflammation comes from, the water weight, all those things. So my pointer to that would be to just give yourself some time to heal and do not, under any circumstances, even walk by your scale. I don't know if you had to put it up in the damn put it in the cabinet until a little bit of time has passed, because there's nothing on there that's going to be pleasant for you. Because I mean, it's the reality of it is there's air in your system that wasn't there before. There's, like I said, the inflammation, the water weight, that those things are going to happen with any surgery. Your body is just trying to heal itself, which means it holds on to every ounce of storage it can to help store those things, up to help heal you. So um the hormonal changes are going to be, the swings are going to be wild. It's going to be hard to get a hold of, and that's okay. You just have to understand that this is, like April said, another life altering major surgery that it's just going to take time to heal from. And I would, like Brenda said, I would reach out to everybody. I would talk to everybody. Talk to your OBGYN, your primary care doctor, your surgical team, because most bariatric surgeons start in general surgery anyway. So they're going to have a pretty unique understanding of what's going on with you. So
Mhm.
I would legitimately reach out to everybody and just propose your question to them and see what they have in store for you, because I'm sure you'll get good insights from all of them.
Jason, we were just talking about this actually last night on our community struggle bus. So twice a month we go live in BariNation in Zoom, and we just hold space for people to talk about what they're struggling with. And we have some members that are going through some big life altering things that are stemming from major medical procedures that they just had. And they were talking about how frustrated they are at not being able to do the things that they were doing before surgery. And we just held space for them. It's okay to be mad. It's okay to be frustrated. It's okay to be in pain. But the way through it is just to be in it and to get through it. And our recommendation for them, besides just holding space and being like, we're sorry, this sucks. There isn't anything that we can do to make you heal faster or take the physical or the emotional pain away. But what we can do is just say, we're in this with you. When you discover something that you think could be helpful, let us know, but we're not going to pressure you into like coming up with something in the moment. But know that grief is a part of this process and this life, and spending time right now to understand you could be grieving some things. You could be grieving the loss of your parts, grieving the life that was, grieving life moving forward, because everybody ages and that just sucks. Um, right. So we directed them to resources in our community that are specific to grief. So if you think that that would help, absolutely reach out to us, and we can absolutely pass some things on.
So in that, I want to share that we actually have your contact information. I'm going to go ahead and share that. We have your website, Twitter, YouTube, Instagram, Facebook. It's more or less just all BariNation.
Pretty
So I
much.
will
Yeah.
put that in the chat box where you guys can reach them. And then I'll also put it on Facebook. I also want to just say, like, would each of you guys have maybe just a few words to recap? Like what your biggest takeaway that you'd like for everybody to have with this?
Listening to your intuition takes time and practice. Don't be mad at yourself if you get it wrong every now and then. The point of it is that you are starting to listen to it. You are taking the time to slow down. You're taking the time to really tune into what's true for you, and you are pointing your ship in the direction that you want to travel. That's what this is all about.
Yeah. I would say one of the things that I preach most is the loudest voice you'll hear all day is the one inside your head. So make sure that it's saying positive and kind things to you. It is very important that we celebrate every little win, every little silver lining, everything along this journey, because the journey's hard enough. Like, why would we make it harder on ourselves, harder on, like, we're so used to being the first person, for us to be the first person that we let down, that we're just used to that. And sharing those little wins and, recognizing those silver linings are really the first step to building up to more, substantial wins, and really starting to see the brighter side of this whole journey. Because to be honest, we got the second lease on life to live it. So let's do that in the best way, in the most positive way possible.
Mhm.
So I also want to share here, BariNation does have, as April mentioned, does have a special membership opportunity, and I will share that. BariNation also is an affiliate of ProCare, which their affiliate link is BariNation, just pretty dang simple, BariNation. So if you want to save 10% off products, can definitely do that. And I'm going to kind of lead to our website, if that's okay, guys. And I'm going to show where, so ProCare Health is our sponsor for those of you guys who may have been new to this platform. You probably have been aware that ProCare Now is the ProCare website, which I will copy here, just procarenow.com. When you get to the ProCare, we've been changing a few things. So the tabs at the top may look a little different. We just have shop, body and soul resources, company, and contact. Under body and soul is a tab called Reconnected, and also partner programs. I have both of those pulled up. I want to first talk about our partner programs, and April and Jason are in BariNation. So if you click the Learn More button, there's some opportunities there to save on your vitamin subscription and also save on BariNation membership. So check that out. If you do have any issues when you navigating this or signing up for that, there's a customer service number here, because we have had a few tweaks that we've been making to our website. You're always welcome to call our customer service number for more of that. Also, just want to say, when you're navigating, you can click onto our Bari Connected page. We are changing that a little bit. Some of these things are kind of big. We need to kind of resize, but we are the upcoming events for this month, including today's, can be listened to for the next month. So you can always click on that to re-listen to this episode if you want to go back, if you want to sign up for any of our upcoming events. And then we also have at the bottom of this page, we have our podcast tabs, and then also under this, our YouTube. So you can click on to our YouTube to watch any of our uploaded accounts. We have on our YouTube channel, we actually have about, I think it's getting close to 500 videos, and we have when episodes go live, you'll be notified if you subscribe to our, pause that, so subscribe to our button. So just do that. You can also subscribe to our Facebook community, Bari Connected. There, April and Jason under BariNation also have a YouTube channel, and I posted that link too there. So want to kind of go back. I also want to just share too, I'm going to stop sharing that screen. Also want to share too, I mentioned something about in January, I'm going to be doing some classes if you're interested in checking that out. The classes that I'm going to be doing are not related, are not ProCare. ProCare has been supportive of me doing them, but they are kind of something I'm doing on my own. My background is in nursing and holistic health. So I actually have a certification in in a practice called Healing Touch and have studied that for a long time. So I'm putting the link there. I'll share that on Facebook as well. It's just a fun 12-week class that I'm doing on practices such as meditation, healing practices, um, sound therapy, music therapy, I don't know, any kind of practice under the sun, EFT, all kinds of fun things that I learned while I was trying to balance my own body and my own mind and my own, call it my own soul, making my soul happy.
Mhm. You were going to teach everybody what you have been practicing for years, Brenda, and that's what this is all about.
It is. I think for each of us, you know, we were talking about we learn through experiences. And I think in the beginning, when I first started learning these practices, honestly, it was, I think I mentioned earlier, I worked in the hospital setting. I worked in ER for 20 some years. And when you're under a large amount of stress for a large period of time, that really accumulated my weight. It it fed on me. Like I was picking up all of this stress, and it necessarily wasn't even stress. I'm going to say it wasn't even stress coming from my own life experiences. It was many people's traumatic experiences that they were going through. And I'm very empathetic. Like I listen with my heart, and I just would take on all of the stuff that wasn't mine. And I needed a way to escape some of that and to learn how to deal with that, with my emotions, with what I was experiencing. So started studying healing practices, thinking I was helping to help teach other people, to help do these practices on other people. And honestly, it's been like life changing for me. So I'm just like, I'm going to share these things with other people.
What it's all about.
It is. We all learn through our experiences, just what you guys are doing. So thank you
Mhm.
so much, both of you, for taking time out. And I want to just thank every single person on this call for taking time out for themselves, investing in themselves, and maybe, hopefully, this talking about intuition will help you dig deeper into those parts of yourself in your own bariatric journey.
That's our hope, right? We all have the answers inside of us. It's just taking the time to slow down, answer the questions that we're asking ourselves, and trust ourselves when we're ready to make those decisions.
Yes. Thanks, guys. Well, everybody have a
Awesome.
wonderful rest of your day. Take care and many blessings.